And this is Full Bloom Friday, my weekly live health show that is soon to be turned into a podcast, so that's super exciting. I like to begin every episode by checking in. This is episode 6 already, and I am feeling incredibly energized this morning. Super energized. Haven't had any coffee, by the way. I did get up this morning, though, and do my morning routine, and I'm feeling pretty proud of myself because this whole week I have gotten up every morning and done my morning routine every morning. And if that's any clue for you as to the imperfection of my routine and my life, that I'm like, oh my God, I did this 5 days in a row. And that's a big deal, right? So none of us are perfect. And I'm super proud of myself today that I have made intentional effort every day this week to get up in the morning and do some breathing and do some meditation and do some exercise. I am loving curling these 15-pound weights. I feel like such a beast, which I can tell you honestly is a feeling I've never had before in my entire life. I digress, though, because today's Full Bloom Friday is not about morning routines, and it's not about working out, and it's not even about meditation. It is about psilocybin therapy. So if you are familiar at all with that topic, you might be aware that the FDA has twice, once at the end of 2018 and then a couple of weeks ago, if that, come out and said, the FDA came out and said that psilocybin therapy is a breakthrough therapy. So thank you, FDA, for catching up to what literally millions of people have known for thousands of years. Thank you, though, because it is going to make this very effective, amazing, radical treatment much more accessible to people in the United States, and be effective and clinically safe, and really do amazing healing for, a lot of people in our country, like it has been doing. Psilocybin therapy has been extremely effective in multiple countries in Europe and around the rest of the world in clinical settings. But like I said, this method of healing and connecting with oneself has been going on in multiple cultures for literally thousands of years. So I do want to start off with just a little bit of history because I love this topic. I think it's so interesting, and especially now that it's becoming and going to continue to become more of a, socially acceptable topic. I am so excited to engage in more conversation about it. So, and first, what is psilocybin? Psilocybin is a chemical compound, a psychedelic compound that is found in over 180 different types of mushrooms. So magic mushrooms, right? That's what we're talking about. And just some brief history, right? We can trace use of psilocybin, use of magic mushrooms, of psychedelics, for ceremonies, spiritual purposes, healing, right? We can trace that back through fossilized evidence for over 10,000 years. And then we can trace through cultural and historical evidence to about 5,000 years, right? But we know 10,000 years, right? This method has been used on our planet by people. So just that gives you an idea, right? Like there's been a lot of scientific research that's gone on in the past almost 100 years, but certainly thousands of years of experiential evidence as well. So in the 30s and 40s, late 30s, early 40s, that was really when mainstream scientific research started, not just on psilocybin, but on all kinds of psychedelic drugs, LSD, ayahuasca, peyote, mescaline, and a lot of those studies that were done in the 40s and 50s were so successful. And at that time, people were excited. Like they expected these methods to work. And they did, right? They were like, wow, like this is so great. Breakthrough therapy, right? In the 40s. Very successful, especially for treating alcoholism. That was a big one. Pain too, depression, suicidality, all kinds of neuroses, right? And it was extremely successful, especially for something like alcoholism, which at the time was, we're kind of in a mental health crisis in our country and maybe even in our world right now, but especially in the 40s, like alcoholism was not really considered treatable, especially extreme cases. So to have a therapy on most of the research that was done with alcoholism specifically was with LSD, and some was done with psilocybin too. But to have psychedelic drugs that were so incredibly successful at healing something that was very untreatable, especially at the time, was really amazing, and people were super excited about it, right? So fast forward 10, 15 years, and by the mid-1960s, LSD was made illegal in the United States. And just with that one psychedelic drug becoming illegal, almost all research stopped, which was really unfortunate because all of it had been successful. But the next 5 years, and there were some other things going on here too. So around this time, the standards for studies and what statistical methods were valid and which ones were, could be proved to be generalizable. So not just the people in the study, but like other people would react this way too. A lot of those statistical standards for scientific testing were getting more harsh, right? So they were setting higher standards. And so some people decided to kind of take that as a way to frame psilocybin and other psychedelic drugs as no longer effective, right? Oh, they didn't have the right numbers, like they didn't have enough in their sample groups. This worked for these people, but really it was, there were all these dangers too, all these risk factors. And so like the second half of the 60s was a lot of like, all of that was, like none of that is true, right? Okay, and of course we all want methods that work. So, of course there's always room to double check things. And so we double checked again in the early 70s, right? So like less than 10 years after LSD was made illegal and all the research stopped, the research was revamped just enough to say, no, we were right. Like even with these new statistical standards and these new ways of conducting scientific research, these new methodologies, we were still right. This is still an effective treatment method, and so it was reproven with the new standards in the early 70s. And in the early 70s, the FDA actually said that that psychedelic medicines were no more risky than other pharmaceutical drugs, which of course, like if we've all seen the millions of commercials on TV that list the ongoing potential risk of every drug on the market, right? So even in the early 70s, the FDA was like, hey, this is actually not any more risky than any of these other drugs that we're propagating. But it was still made illegal, and other psychedelic drugs other than LSD continued to be made illegal, in the United States. So the United States at that point, kind of started gearing more towards the war on drugs. But in Europe, that tangent didn't happen, right? So in Europe in the 70s and the 80s, they started continuing that research on psychedelic medications. And in Europe, so the FDA is just now saying, right, the United States FDA is just now saying this is a breakthrough drug, right? It has been used in multiple countries in Europe and in other parts of the world clinically for decades, right? They continued to do the research in the late, the last century, the late 1970s to 1990s to 2000. They continued to do the research. They started to implement it in clinical practice, and it's been incredibly successful. Like the real life, it is successful, right? And if you're like me, and you grew up here, you might be, having kind of a moment where you're like, what? That's not at all the impression I was ever given about psychedelics, right? Which I can totally relate to. So I feel you. This is real though. Like, this is the reality, is that there have been a lot of things that were kind of blacklisted as unhelpful and potentially dangerous or dangerous. Talk specifically about psilocybin, although there has been research done on a lot of other psychedelic drugs. I do want to specifically talk about psilocybin therapy. So how does psilocybin chemically work, right? Like, so it can be taken a lot of different ways. They just came out with like a nasal spray as a pharmaceutical treatment, and understand that these methods, so they are starting to be tested, thank goodness, starting like last year, I think, was when the first study opened. And now there are a few studies going on in the States, in the United States, to get that same validity that Europe has already gotten, so we can start to implement it in our clinical practice here. And so, but understand, when I'm talking about this nasal spray, right, it's not, you can't go ask your doctor for it, and it's not on the market here. This is something that maybe is being used in testing here, but is mostly on the market in other countries that are further along in this process. So again, how does, one second. Hydration break. Okay, so how does psilocybin chemically work? So psilocybin, as well as other psychedelic drugs, they chemically mimic very closely serotonin, which is a neurotransmitter that we all produce naturally. All animals produce it. And psychedelic drugs mimic very closely the chemical compound of the neurotransmitter serotonin. So when a human takes in psilocybin in one form or another, the receptors in the brain that are made to receive serotonin, psilocybin will attach to some of these receptors for the time that it's in the body. And so psilocybin is considered an agonist. So that means that it attaches to the receptor and then produces a physiological response. So the opposite of that would be an antagonist, which is, for instance, an SSRI, very common antidepressant drug, that blocks the receptor so that the serotonin stays in the system longer, in the synapse between neurons, and can build up to greater amounts. So there's my brief amount of neuropsychology for today, the little bit that I know about. Well, I do know more, but for this topic. Okay, so and then when psilocybin or other psychedelic drugs connects to the serotonin receptors, it produces changes in perceptual experience, right? So auditory experience, visual experience, somatosensory experience, so like touch, feel, time, right? Just perceptual changes. Think of how you're perceiving the world, and those things seem to change when one is under the influence of a psychedelic. So how is this helpful, right? You may be like, okay, so all this research is pointing towards it being extremely successful, and we know how it works, but why is that helpful? Okay, so here's a little bit of, these are studies from 2006, 2011, and there were a lot more, but I just picked 3 because, we only have, well, anyway, I mean, honestly, I would talk about this forever. So if you want to talk about more studies, message me, I'll talk to you about them. Okay, so, but I looked up some studies. All of these are double-blind studies. They had significant sample size groups. A double-blind study means that neither the researchers nor the participants know who is receiving the actual medicine, the psilocybin in this case, or the control group who is receiving a placebo. And that's considered a very good practice as far as research, right? Because if, even if the participants don't know what they're getting, but the researchers do, there's potential for researcher bias. So a double-blind study is considered to be particularly valid and reliable. So just some cool things from these studies I read. One was that so people are more likely to be, let's see. Okay, so, well, I'll start with a brief explanation. There's something called the 5-factor model of personality, which is these 5 personality traits. You can think of the acronym OCEAN: openness, conscientiousness, extroversion, agreeableness, and neuroticism. And this is used a lot in, personality tests, job hiring processes, etc. And what was found in this study is that being high in the personality trait openness is positively correlated with having a mystical psilocybin experience. And not only is prior high levels of openness correlated with having a mystical experience, but even at 16 months after, these people's levels of openness were even higher. So the psilocybin experience increased their already high levels of openness. And this is like 16 months after, right? So one of the most amazing things to me about psilocybin is that it's very long-lasting effects, right? Like much more so than a lot of other pharmaceuticals that require, daily medication, maintenance treatments, right? The effects of psilocybin and other psychedelic drugs tend to be extremely positively long-lasting, which is great because that's what we need. Is we want something that will help us with more permanent change in these situations where we're trying to treat mental health conditions. So that was something I thought was really interesting about openness. And this other study that was done, both immediately after and at a 14-month follow-up, the participants rated their experience, their psilocybin therapy session, as among the top, so 58% of the participants rated it in their top 5 meaningful experiences, and 67% rated it in their top 5 spiritual experiences. So these sessions are obviously very impactful, right? Very significant. People tend to experience higher levels of open-mindedness, mood, cognition, creativity afterwards. So some of these studies that I'm citing have been done with people, people considered to be healthy participants, right? So this is kind of just an overview of, for someone who may not be needing treatment necessarily, but is just taking it, like what is someone who has a, I don't know what normal is, but an average baseline of emotionality. What are the effects of psilocybin therapy on them? And the last study I'm going to talk about is just just these numbers, right? I'm just really trying to convey these high numbers that are beyond significance. So there's something called statistical significance, which means that it's basically saying these numbers, like the amount of people who responded well or responded not well to whatever is being studied, this wasn't by chance. It was significant. It's not just because of the subjectivity of the participants. It is because of whatever was being tested. And so I'm really, and so that statistical significance is nowhere near the 50 and the 60% that I'm citing for most studies, right? It's lower, depending on the sample size, of course. But what I'm really trying to convey is these high numbers, right? So the study that was done, they pulled data from 8 double-blind psilocybin studies. and analyze the acute, so immediately after, short-term and long-term subjective effects. And in this was interesting. So the last study I talked about, they catered the environment to kind of produce potentially, or be more likely to produce, encourage a mystical or spiritual experience. And none of the, so now the meta-analysis, which is what it's called when you compile a lot of studies and analyze that data, none of these studies attempted to encourage a mystical or spiritual experience. And still, at 8 to 16 month follow-ups, more than 60% of the participants rated the experience as very enriching, and more than 90% rated the experience as enriching, at least to like a medium degree, right? So I'm not sure there are exact methods of measuring this, although if you want to know, I can find out. Cool thing about peer-reviewed studies is you can go back and look at them. But 90% rated the experience as enriching, at least to a medium degree. So we could imagine they had a number scale, and that 90% at least said it was a 5 out of 10, right? Like, and 60% said it was very enriching, right? So maybe an 8+ out of 10. And those are really high numbers, right? As far as looking for a treatment method for whatever neuroses, alcoholism, suicidality, anxiety, eating disorders, PTSD, whatever we're looking at, like those are really high numbers. Like we need treatment methods now. Like we're kind of in a mental health crisis in a lot of ways in our country. A lot of things are changing. We need to find methods and treatments that work, which psilocybin therapy does. Like one of the two, I think, of the two of the primary and mostly unique benefits of psilocybin therapy as a treatment are one, like its long-lasting effects, right, without the need for maintenance, and its ability to treat treatment-resistant cases and conditions. Hydration break. So I'm going to throw some specific diagnoses at you: PTSD, eating disorders, and addiction. All very, these are some conditions that are hardest to treat, right? We have the methods that we have on the table for the most part are much less effective with these diagnoses than others. And psilocybin therapy, however, is very effective at treating these things. So especially for treatment-resistant conditions, this is such a breakthrough therapy. And so you might be wondering, like, how does this work? Like, how does psilocybin therapy or a psilocybin therapy session, how does it work? So so I'm going to talk about two things. I'm going to talk about the really only clinically implemented method, which is like a 1, 2, or 3 dose regimen. And then I'm also going to talk about microdosing and in just a second. So like a 1 to 3 dose regimen. And please understand that this is especially in the United States, right? This is a very new technology. So I read a lot of studies, and it really doesn't seem like there's necessarily a normal application. Different regimens might be done depending on the person, different doses, but here's like an average of what I found, right? Is a 1 to 3 dose regimen. Most of the studies that I read were like 1 or 2. These doses are given during a like 6 to 8 hour session, and administered 1 to 6 months apart. So I'm going to speak about myself like I'm going to a psilocybin therapy session. And I would go to this office And I would be met there by my therapist, my psychiatrist, my doctor. Although in this case, most of these facilitators are not medical doctors necessarily. They are people who are specialized in mental health. So maybe a psychiatrist, but probably not just a primary care physician, right? So I would go, I would meet my therapist, or maybe I started seeing a specific therapist just for this psilocybin therapy session, and we would, I would receive about 30 milligrams. That seems to be about the average for a single dose of psilocybin. And there were a couple of ways that these sessions tend to play out. The one that I'm going to describe, because it was my favorite, and because it was, again, kind of like an average of the things I read, is that the patient, I would lay on a couch, and have a blindfold, like a sleeping mask on, right? So being very much in my own space. And the therapist, and one of the studies even described that there would be a male and a female therapist in case, for whatever reason, whatever was coming up during the session, if there was if I was particularly wanting to talk to a woman or particularly wanting to talk to a man, both would be available. But in this specific type of session, I would lay on the couch with a sleeping mask on and have my experience. And for the most part, the therapist would not even interact unless I asked for it, right? Or unless maybe, I guess, if something went wrong. I didn't read any information, any studies about clinical settings where something went wrong. And the person has their experience in a safe, controlled environment. And so yeah, and then maybe next month or in 3 months or in 6 months, I might go back and do that same thing again. So that is I don't know, that's my description of a typical session. I also read this really interesting article that was talking about some studies done in collaboration with Johns Hopkins, and they had a team of people, music theorists, musicians, music therapists. This team compiled a playlist of songs that would be most effective, most received by someone who is in a altered state of consciousness, which is ASC is a common acronym that's used, altered states of consciousness. And I just thought that was so cool, right? They scientifically compiled this playlist that is a lot of classical music. It's on Spotify. Like, look on Spotify or Google it. Like, it's look up Johns Hopkins psilocybin therapy playlist, something like that. It's on Spotify. I found it. And they found this music that would be even more received by the brain. If I'm remembering correctly, they found that this music increased the neuroplasticity that psilocybin naturally encourages, which I just think is so cool, right? So clearly this is a topic I really love, and for real, like, if you want to talk more about it, please reach out, because I have a lot more to say than I'm just going to say in this live. So the other method of, I can't really call it therapeutic dosing because there hasn't been studies, research done. It's not implemented clinically. However, there have been studies, but they're only surveys, right? So it's not a controlled study. Hydration break. So there have been studies done via survey, self-report, on microdosing. Microdosing is this idea of taking a small, typically undetectable, like the idea is to not be able to feel it, amount of psilocybin that's about 1/10 maybe of a full dose on a daily or a regular basis. So maybe every 3 days, or like maybe take it for 3 days, skip one, or take it for 5 days, skip one, or take it for 2 days, skip three, whatever. A regular basis, though, of a small amount. So that's what microdosing is. And there have been a lot of self-report studies done, just none done in a clinical setting, in a controlled setting. But these self-reports have also all indicated lower scores on measures of dysfunctional attitudes and negative emotionality, which I think we probably all want. At least I want that. And higher scores on wisdom, open-mindedness, mood, cognition, creativity, when compared to non-microdosing groups, which would be the control group, right? So super cool, lots of potential there for sure. And I'm sure as psilocybin therapy continues to be talked about and propagated, that there will be research, controlled research, which is kind of the step prior to getting it into like the pharmacies, right? I'm sure there will be research done on microdosing as well. So a couple of big things like that I really, 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 really want to reiterate. So if you didn't watch any other part of this, please watch this. Is that one, research has been done, lots of research, and not just, right? I think this is probably one of the things that it's clearly not just in the scientific research, also certainly in experiential evidence, to show that external factors, environmental factors, can significantly affect the outcome of a psychedelic experience. So it's not just about what you're putting in your body, right? It's about the environment. Who are you with? What are you doing? What did you do earlier that day? What kind of mood are you in? And so why is this, why am I kind of putting some flashing lights around this, is that positive effects are correlated with intentional practice and a mindful environment. Okay? I'm just going to leave that where it is. And the second thing, and this is even like, please, flashing lights, listen to this. So these substances, no psychedelic drugs, including psilocybin, including LSD, including mescaline, including peyote, including ayahuasca, they do not lead to addiction or dependence, and they are not considered to be reinforcing. Physically reinforcing, it just means you do it once, you want to do it again, right? So once again, for anyone in the back, psychedelics are not physically, chemically addictive, and there is no scientific evidence to suggest that use will lead to abuse. Okay? So like, let's just be clear about that. In the United States, at least, what I feel like my impression has been, the lesson that I had, the story that I was told for a long time was that psychedelics were very dangerous. And the reality is that these drugs are very physiologically safe. I talked about how psilocybin connects with the serotonin, neurotransmitter serotonin receptor, right? And things tend to work better with our bodies when they can directly connect with a receptor that we already have, because we make something that is chemically similar to this thing that we're introducing to our body, right? So there are some substances that we put in our body, like SSRIs, or, numerous things, right, that don't mimic our natural chemicals, and therefore they interact with our body in other ways. But things like psychedelics, caffeine mimics the adrenaline receptor. No, adrenaline? Caffeine mimics a certain receptor too, which is why it's also extremely effective just in the sense of we experience dramatic effects from it, right? Because it can very naturally work with our bodies. So, to cover myself, and certainly I always want to talk about the whole truth. There have been some very few exceptions to the rule that psychedelics are not safe. And in those few in those very few situations, we're talking a handful of studies, if that, the dose administered of psilocybin was very high, extremely high, much higher than is ever used in clinical practice, much higher than other studies have done, right? And that is when it has been shown to be dangerous, is in extremely high doses. And we're talking about, psilocybin is being extracted from the mushrooms and then, maybe taken intravenously. So high concentration, straight to the bloodstream, that is the situation in which it is dangerous, which is less than 1% of intake in general, right? So I really do want to emphasize that psychedelics are not in and of themselves dangerous or addictive. And gratefully now, the FDA is on board too, and so hopefully we can really get this moving as a topic of discussion, of research, of treatment, and start propagating these amazing methods of healing that have been used for thousands of years, and really implement them in a time when we certainly need them. And the mental health of our country and of the world is certainly calling out for radical treatments, which this is. So, this is something I'm super excited about. And if you have any questions or want to talk about this more, even if you don't agree with me, let's talk about it. Cool, we can have a conversation. So yeah, and like I said, I think I mentioned this at the beginning. I've definitely mentioned it on other episodes. I'm going to be turning Full Bloom Friday into a podcast soon. I got a 2-person podcast kit in the mail yesterday. Thank you, Mom and Dad, for that. And my previous timeline was to start that sometime in February, and now I'm thinking we'll probably start at the beginning of the new year. So, Happy New Year. I hope all of you are having a great winter and holiday season, and just take care of yourself. Remember, this is every day is an opportunity to learn and to grow and to learn how to love ourselves better. So I certainly am sending love to all of you, and I hope that you all have an amazing day. Feel free to reach out if you have any questions or if I can help you with anything. Have a great day.